Marley Drug.
Hi, my name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. When it comes to dealing with dry, rough, or even scaly skin, Urea can be a really effective topical treatment option. You might have heard of it being used for conditions like eczema, psoriasis, or even thick calluses. The reason Urea is so helpful is that it acts as a keratolytic, which means it works to both moisturize and gently exfoliate the skin at the same time. You can find Urea in different forms, from over-the-counter products to prescription-strength treatments, depending on the severity of your condition. Urea comes in various brand names and it is available in several forms. There's a cream, which is probably the most common because it's easy to apply and absorbs quickly. Then there are lotions, which are a bit lighter and often used for less severe dryness. For very dry areas or thickened skin like calluses, ointments are thicker and more intensive. Urea also comes in gels and foams, which spread easily and dry quickly, making them a good option if you prefer something non-greasy. Now, when we talk about Urea, the strength of the product is important because that determines how and when it should be used. You'll see it in low strength like 5% to 10%, which is great for mild dry skin or daily moisturizing. For more stubborn issues like keratosis pilaris, you'll probably use something around 20 to 30%. Higher strengths like 40 to 50% are usually for severe cases like ichthyosis or thickened callous skin, where a stronger exfoliating effect is needed. So how does Urea work? First, it helps your skin hold onto moisture by attracting water, so it's constantly keeping your skin hydrated. At the same time, it works on the surface to break down and remove dead skin cells, which helps to soften and smooth out rough patches. That combination of moisturizing and exfoliating is what makes Urea so versatile for treating conditions like eczema, psoriasis, keratosis pilaris, and even tough spots like calluses on the feet. If you're using Urea to treat dry skin or something like keratosis pilaris, you'll probably need to apply it once or twice a day until you see an improvement. It can take a couple of weeks to really notice the difference. For conditions like eczema or psoriasis, you might need to keep using it long-term to maintain those results. And in cases where you're softening up thickened skin or nails, you'll continue using it until the area is softened enough. When applying Urea, you'll want to start by cleaning the skin with water and a mild cleanser, then drying it off gently. Use just a small amount, apply a thin layer, and rub it in until it's absorbed. You'll usually apply it once or twice a day depending on what your healthcare provider recommends. Just make sure you avoid applying it to sensitive areas like around your eyes or on broken skin unless your doctor tells you otherwise. Now, you might notice a few side effects when using Urea. Some may experience mild irritation like redness or itching, especially if their skin is sensitive. A little dryness or peeling can happen too, particularly when you first start using it as your skin adjusts to the treatment. There might also be a slight burning sensation when you apply it, especially with higher strength formulas. If you ever experience more serious symptoms like a rash, swelling, or any kind of allergic reaction, it is important to stop using the product and get in touch with your doctor. One more thing to keep in mind is that Urea can make your skin more sensitive to sunlight. So if you're using it on exposed areas like your hands or face, it is a good idea to apply sunscreen or avoid direct sunlight to prevent irritation or sunburn. And if you're pregnant or breastfeeding, be sure to talk to your doctor before starting Urea, especially the stronger concentrations. And if you're using a high-strength formula over a large area of skin for a long period, it is always best to do so under medical supervision to prevent any unwanted side effects. Finally, if you're ever unsure about how or when to use Urea, or if you're dealing with a chronic skin condition, it is always a good idea to check with your doctor. They can help guide you on the right concentration to use and make sure that Urea is the best treatment for your skin needs. Plus, if you're using other treatments, they can make sure everything works well together and prevent any possible interactions. You can read more about Urea and various skin conditions on our website, so check those articles out in the links below. And if you have any questions, be sure to ask your doctor or leave them in the comments below. And don't forget to subscribe. Bye for now.